So this song is already 43 years old. Wow. And talking of love, we got chocolates and we've got condoms. I'm not giving away condoms, but I'm giving away chocolates. Courtesy of Cocoa Processing Company. We're celebrating, it's like a whole chocolate week. Tomorrow is National Chocolate Day, but we're celebrating Chocolate Week this whole week. So watch out for goodies from all of us right here at GTV Breakfast. Right now, we're going into our conversation in the BFS clinic, and we are dealing with something that used to afflict me when I was really young, in primary school. Asthma. And my guest is a family physician and the medical superintendent at the Koforidua Polyclinic, Dr. Kwame Ofori Koramwa. Kwame, good morning.
Good morning.
It's good to have you here.
Thanks for having me.
Yeah, just one day I got up and then I just couldn't breathe well, and it turns out that I had asthma, and it was just crazy.
Yeah.
Can it be that sudden? Can you get asthma all of a sudden like that?
Yes, it can be sudden. So basically, asthma is supposed to be a chronic condition, and it's characterized by inflammation of the airways and hyper-responsiveness. So if you say inflammation, the airways are supposed to be like this, but when they are inflamed, it becomes a little bit smaller. So air going in becomes a little bit difficult.
When you say inflamed, does it mean it's swollen?
Yes.
Why is it swollen? Why is it inflamed?
Because your body is reacting. So hyper-responsiveness, it's like killing a fly with a sledgehammer. The smallest thing, the smallest allergen, dust, then your body starts reacting that dust is a big deal.
Okay.
So that's what happens. So when the swelling comes, it becomes a little bit smaller, then breathing becomes a little bit difficult. So that's what happens.
So like stepping on a water hose and preventing water from flowing. Okay. Why does this happen?
Good. So as I said earlier, some people's genetics are made up in such a way that the slightest thing, then it will just trigger something. So as I said, maybe I inhale dust, it doesn't really cause anything. Someone uses a strong perfume, it doesn't cause anything. Someone has a cold, it doesn't cause anything. But for other people, all these things that I've spoken about, slightest thing, then the inflammation comes in. Then their body starts reacting. Then they find difficulty in breathing.
So does that mean asthma is strictly a genetic issue? It has to do with the way you were made up?
In a way, we can say yes. But it's been shown that for some people too, there are other conditions that predispose you to asthma. Obesity is one. Obesity in children. Okay. That's one.
So if children are overweight, they can actually...
Yes. It will increase your risk of having that one. If you have gastroesophageal reflux disease, like, I don't know how to make it a little bit simple. Like, the food really doesn't go down. It gets stuck in your throat there.
Is it the one that makes you feel as if there's something blocked in your neck?
Yes. So you have like heartburns.
Heartburn.
So risk of having that one. It's also been shown that children that had a rhinovirus, like a virus for upper respiratory tract infection, if they had that one, they are at risk of developing asthma. And it's also shown that children that grew up in the urban area as compared to rural area also develop asthma.
Why is that?
So basically, they talk about antibiotics, maybe exposure to antibiotics, exposure to these viruses that I spoke about, exposure to irritants, the smoke and all those that in the urban areas compared to the rural
traffic
area.
fumes, more pollution, it makes you more exposed to, more likely to get asthma.
Yes.
Years ago, when I was in boarding school, there was one of the juniors who so many nights had to actually spend the night sitting up. He couldn't lie down to sleep.
Yeah.
Discomfort. And we heard that it was asthma, that he was severe asthma that he was suffering from.
Yes.
Why is that so? Why did they have to go through all that pain?
Okay, so as I said earlier, the basic thing is there's inflammation. So normally you should be able to breathe well. It's supposed to go through. But he said when you step on it, when it becomes a little bit closed, then you find difficulty in breathing. So maybe they sit up, raise their head so that they can get in more.
Exactly. That was how he was. His head raised up.
Yes.
So meaning if he lay down, it would make it even worse.
Yes.
And then he died years later. So asthma can be fatal.
Very fatal. So the thing is, it's about how we manage the patient, how we see our patients. Some people think asthma is nothing. It's a spiritual disease. It can be cured.
Spiritual?
Oh, maybe that's what some people say. So you're supposed to come to the hospital as soon as you have a first one. I see patients who say they don't know whether their children have asthma or not. If you don't know, you come to the hospital based on what you present with.
Yeah. Are there types of asthma?
Good. There are types of asthma, so you can break it down based on the severity of asthma. So it can be intermittent, it can be mild persistent, it can be moderate persistent, and severe persistent. These ones are based on how often you get attacks during the week. So maybe if it's the intermittent, it can be about 2 to 3 times in a week. If it goes to mild persistent, it can be up to 6 times a week. So those ones are that. Then based on etiology, based on the causes. So as I said, you can have allergic asthma. That one is due to the allergens that we're exposed to. We can have exercise-induced asthma. Some people, as soon as they exercise, then they start having the attack. And this one is based on the dehydration and dryness of the upper respiratory tract. So they'll have that one. We have drug-induced asthma. That one is NSAID. Some people were shown to have asthma when they take aspirin. So that one is also another one. We have occupational asthma. So those ones, they will tell you during the course of the week, they have the reaction. But weekend, they are fine. They don't have difficulty in breathing in weekends. And based on the work they do, whether they work in maybe a cement factory, they are farmers due to the pollens, maybe they take care of animals. So all these ones are things that can affect us. And this might be the classification of asthma based on either etiology or the severity.
I think mine was probably due to maybe the things that I was allergic to. I don't know.
Yes, maybe you
was irritating.
Yes, so if you're allergic to some things, maybe dust mites, maybe animal fur, if you come close to any of this, it can trigger your asthma.
I read somewhere that you can actually tell if somebody has asthma by the way their shoulders are raised. Is it true?
Okay, good. So that one is based on where their shoulders are raised. If you examine them, someone are shown to have chest like
that. Yeah.
Yes, good. So that's one of the things that we look.
Why is that so?
So as I said earlier, that was basically due to it's physiological. So they want to get I don't know how to put it, like expand the lungs
to receive more air
okay, as compared to the normal people.
Okay.
Because that's how their body is supposed to be, because they need more as compared to us. So that's what happens. So the frequent expansion or the frequent physiological need for the air makes it happen like that.
Is there a test for asthma?
Oh yeah, there are tests for asthma. So when someone comes with difficulty in breathing, as I said, maybe the first time the patient comes, has a cough, has difficulty in breathing, they will tell you they have maybe chest pain. And maybe they would have had it before, or they have a family history, or the relatives have allergy. You can suspect asthma based on how they present. So there are tests that you can do. So you can do a chest X-ray. It might not give you much. You can do spirometry. Spirometry makes you diagnose it. So they blow into a thing, yes. Then you do some calculations and you get to know. Then after you give them an inhaler, what you say, salbutamol, we nebulize them. So when there's reversibility, then you know that was asthma. It means whatever they had is reversible with that particular drug. Good. So based on this one, then we can know.
And so then you prescribe the...
Yeah, you prescribe the basic medication for them based on how they presented.
Okay. What is the range of medicines that you can...
Okay, so basically when they come, in acute setting, we have steroids that we give them. The steroids will make the inflammation go down. Good. So that's what you give. You give your beta-2 agonists, the long-acting ones or the short-acting ones. So the ones that we all know is salbutamol, Ventolin. So they have a blue inhaler that they give.
The L-shaped guy.
Yes.
You know?
So that's what we are using. We use labels. So you see they would have a face mask on with a machine there that will sort them out. So that's what we use. So basically give a steroid and give a beta-2 agonist. There are leukotrienes, there are other drugs that we also give. But when they are going home, we give them drugs that will prevent them from having the attack again.
Okay.
So normally the drugs are divided into two. We have preventers and relievers. The relievers are what I spoke to you about. The steroids that we give when they come. Good. Then we have the preventers. The preventers are also steroids. So if you give you a preventer, it's a steroid and the long-acting beta-2 agonist. So if you give it this one, you will not have the attack, or the frequency of the attacks go down. So based on how often you get the attack, then we know what to give you. So it's either we step down or we step up. So I see you today, I give you medication, I see you in like 2 weeks time, then there are asthma control tests. I ask you questions. Did you wake up at night with difficulty in breathing? How many attacks did you have? How many times were you coughing? Based on that one, I'll know whether I'm stepping up or I'm stepping down with the medication that I'm giving you.
How common is asthma in Ghana?
Asthma is very common. So for the study that was done, Ghanaians, you don't really have much of that one.
Why don't we do studies, my brother?
Oh, dear.
We don't want to know or what.
Oh, sometimes I think we would love to know, but there are other things that maybe we might think it's important. Maybe.
But this is life-threatening.
Oh, but now I think there are more studies. So if you look at maybe about 10 years ago as compared to now you get to see papers written by Ghanaians. There are more studies. But I think now basically we are really doing good. Even for international papers, you see Ghanaian names, our system, we are happy. So now we are
contributing
really,
to knowledge.
Yes, yeah. And it makes it a lot for us. It's really getting better.
So in terms of the breakdown, male, females, I mean, who tends to get it more?
So for male, female, most conditions males have. So there's a slight preponderance for male as compared to females. Just that one, not like it's a bigger, maybe about 1 to 10 or something, but it's just a slight for males. Yeah.
What's the earliest in terms of age that you've seen somebody with asthma?
Okay, so for that one, the diagnosis makes it a little bit difficult. So for you to really diagnose asthma, normally it's about more than 3 years of age, because if they are below 3 years, there are other conditions. Bronchiolitis might look like asthma. Even a normal upper respiratory tract infection might look like asthma. So after 3 years, you can diagnose asthma. But it's been shown that when they are above 5 years, they understand, they can just comprehend the things they are telling them to do. So after 5 years, you can really diagnose asthma. So the percentages go up as the child grows.
What should I do if what are the signs of asthma so that I know that I'm getting it?
Yeah, so that's why I started first. So the first thing is the cough. There's cough and there's wheezing. So wheezing is like a whistling sound. Yeah.
Okay.
Yes.
All right, that sounds.
So they have that one. Some might have chest tightness. They'll tell you there's chest pain too. So these are the 3 main ones. There are other ones that will come. So if it might be due to an upper respiratory tract infection, they'll be having runny nose, they'll be having teary eyes. So those ones are not the main ones. The main ones are the cough, difficulty breathing, with the wheezing.
What should one do when you see that happening to somebody or happening to yourself? Immediately, as an emergency measure?
Oh, you go to the nearest facility. That's the first thing. But if you have the salbutamol inhaler, then you start using it. That's the first bet. Right after that, you go to the facility. We notice some of the patients, they have this one, they start using it and they stay home. Then it gets worse, then they start running. As soon as I start using it, even if it's getting better, just go, let's assess you, then get to know if it might be due to a chest infection, a pneumonia.
Okay.
Then just use your inhaler, you are okay, then stay home. No. It means that you need an antibiotic because the chest infection triggered your asthma.
So do the puffs and then go.
Yeah, come to the facility.
How many puffs are recommended?
You can do 2. And it's also based on the age. Maybe children will do 1 for adults. So even the one that you have, whether it's the L1, the salbutamol, whether there are other one, the disc or the table healer, based on your age, they will tell you what you're supposed to be using.
Can one overdose from those? What's the drug?
There are patients who didn't know. I think I had a patient, she didn't know how to use it. She got it. And she's been using it very funnily. Because of the L shape, instead of doing this, she was doing it this way.
Oh, like a spray?
Yes.
Into her ears?
Yes.
Why?
Because she wasn't taught how to use it properly.
But why would you spray any?
No, it was like this, yes. So it means we need to educate our patients on how to use the drugs. So for those ones, the best things that we do, we tell to go get the medication. You come, we demonstrate it to you before you go home. So by the time you go home, you know you are using the drug correctly.
Are there foods that can occasion an asthmatic attack?
Okay, so as I said earlier, if it's an allergic asthma. If you are reacting to, so I can say asthma is the senior brother of allergies. So react to fava beans, react to seafood. This ones can trigger your asthma. Because you are just allergic to those ones.
Okay.
And allergens might trigger your asthma.
Okay.
So any food that you react to,
Okay.
it can trigger your asthma.
All right. So the illustration side by side with you, it says tobacco smoke, we got pets, we got mold, cleaning products, pests, air pollution. It's quite a wide range of things that can actually trigger asthma.
Yes.
Okay. In I don't know, Ghana data, I mean, what's the most common trigger here in this country?
Okay, so for the children, based on who that presents, the most common trigger is the upper respiratory tract infection. That's what they normally have. So most of the children that come, you get to know they had an upper respiratory tract infection, and that's triggered the asthma.
I must imagine that during the lockdown time, COVID time, where people were at home a lot, what was happening with asthma cases?
So during the COVID time, we wouldn't, I don't know of any data now, but like we made arrangements for such patients to come. So we even told them, if you have a condition like that, if you are supposed to give you medication, we give you for about 2 or 3 months, and we tell you, we give you a line that you're supposed to call. If there was a problem like that, you call the line, then we help you, or we make you come to the facility. So that's how we were helping the patients. But during the COVID time, the emergencies were still there. They were still coming.
They were still coming?
Yeah, they were still coming.
Yeah. Because I think a severe asthma attack will be considered an emergency.
Any asthma attack is an emergency. Any asthmatic attack is an emergency, so you just need to come to the facility.
Perfume can also occasionally.
Yes. Yeah. Yes. So people can get an asthmatic attack based on the perfume they use, whether it's like maybe a strong scented perfumes. So they can also cause attacks.
Okay. All right. So join us. This is the BFS clinic on the 13th, Valentine's Eve. You know, we have New Year's Eve, Christmas Eve. This is Valentine's Eve. If you don't buy your gift, look sharp. All right. And we're looking at asthma. And my guest is Dr. Kwame Ofori-Kramah. He's a family physician. And if you have any questions for us, would love to hear them on our WhatsApp number 055 556 1034. And we're also live there on Twitter Space on the GTV Ghana handle. So check it out there. And if there are any questions for us, we'd love to hear from you. What else can you add to this conversation about asthma? What do people have to know? Okay, so people are supposed to know. So some people think as you grow, your asthma goes away. So as you said earlier, it's when you were younger, you had asthma. Yes. So the question is your asthma gone? I haven't had an attack.
Is it gone? I just want to know.
I don't know. So you're telling me that it's still around.
Good. So that's the thing. So it's not like the asthma is really, really gone.
Okay.
So as we mature, we know how to deal with the irritants more. Our airway becomes a little bit matured as compared to when we were younger. So some people may not have attacks at all, but it doesn't mean your asthma is gone at all. So you may not be taking any medication or that, but once a while, it might pop up, but it doesn't mean as soon as you grow, your asthma is cured. The asthma is not curable. So we manage the asthma. You
know, I must admit though, there's sometimes when I do some serious jogging, then I feel that I need to slow down.
Yes.
So mine is probably exercise induced.
Yes. It might be exercise induced.
Okay, so it's never quite gone.
It's never quite gone.
All right. Is it expensive to treat?
I would say it's relative, based on how your pocket is, because the medications, maybe the preventers, I think for a month's supply might be, I think about 200 Ghana. That would just be for the preventers. Okay. So if you get that one, it means almost every month you might be getting, you might be using 200 Ghana based on the dosage that we are giving you. Okay. The other medications that you're also supposed to be having. So it's really, really based on how your pocket is. So if 200 Ghana is normal, then it's really not expensive like that. Yeah.
Is it covered by the national insurance?
The preventers, for now, I know the last time I checked, it wasn't really covered. But I don't know. I need to check on that one for you. But National Health Insurance, I don't think it covers the preventers. But if you come in the acute setting, most of the drugs that you come with, they are already covered.
Is there data on the mortality?
Okay, worldwide, it's about 8 per 100,000 people die of asthma.
Okay.
Every year.
What's the for Ghana? Probably in that same range.
For Ghana, it might be something similar to that one, or maybe less, as compared to the pollution that we have, as compared to the Western world, because our pollution is a little bit low as compared to them.
Okay. Final word. Give them a takeaway from this conversation.
So if you're an asthmatic, the main thing you're supposed to know is stay away from your allergens, then use your preventers. Please use them. If you give you the preventers and you go home, use them. Don't put them somewhere and come with an attack.
The preventers are the inhalers?
Yes.
Okay.
Yeah, but
it should be in your bag.
It should be in your bag.
Okay.
There's one that you use, even if you don't have an attack, you use it every day. So please use them so that you don't have an attack.
All right. Well, thank you so much. Dr. Kwame Ofori-Kramwa is family physician, medical superintendent at the flowers in Kofi Town.
Yes.
Flowers are there plenty.
Baby.
All right, Charlie. Some chocolate for you to go and give the flowers. It's Valentine's Day.
Yeah.
So I'm giving you chocolate. All right. With Atu.
Thank you very much.
You're welcome. Happy Valentine's Day to you.
Same to you.
You have a Valentine.
Valentine.
You have one.
Oh, I should have a Valentine.
You should have, but you have.
Have Valentine.
All right, Kwame, thank you very much. And shouts to our people on Twitter Space, on GTV Ghana, following the conversation right here on ASTHMA. So still to come. Well, today is World Radio Day. I'm looking for my condom. That's my condom. Okay. Today is World Radio Day. Today is also International Condom Day. So if it's not on, it's not in. So yeah, and this is what it looks like. A condom. Yeah. It can save a life. It's not. And somebody who wants to become president is going to be on our show today. He's Dr. Kofi Kunedu Apreku. Thelma will be scooping with him on the show. And then in your world on today's show, what will be your ideal Valentine's treat? What will be your, I'm going to use you as a guinea pig. What will be your ideal Valentine's Day treat?
Valentine Day, I know that they chop.
You know that they chop, eh? You know, Pojo Baby will know they chop Valentine.
You know, Pojo Baby me.
If you, eh?
I get to go bed.
All right, what's your ideal Valentine treat? Let us know. 055-556-1034. This is GTV Breakfast, and the sports news comes up in a short while. Charlie, now the condoms are doing red. Never knew. Red condoms. Why? The thing is smelling like strawberry. Really? Yeah, so this is it. Yeah. Sports news next.